The hip joint is one of the synovial joints, and we need to have a look at it because many people, especially old people, complain about problems in this joint. In order to understand joints, we need to recycle and reuse our knowledge of the skeletal system so that we can understand the structure and movements of joints. Let us look at this mind map of the hip joint so that we have a starting idea of what we are going to see. The first idea we are going to address is what type of joint is the hip. It is a synovial joint. Of which type? It is of the ball and socket synovial joint. What is the ball? The ball is the head of the femur. And what is the socket? The socket is the acetabulum. Now, and we know what is the head of the femur and what is the acetabulum and what is synovial joint. The next idea is movements. As we can see that the hip joint has lots of movements because it is ball and socket, and this is the type of joint that has lots of movements. And is this hip joint is the same as the shoulder? The answer is no. The shoulder is the most movable joint, and the hip joint is movable, but it is less movable than the shoulder. And there are reasons for that, and think of the reasons. The hip joint can do flexion by a group of muscles. Extension, it is done by a muscle called gluteus maximus. It does hyperextension, abduction, adduction, rotation in the medial and lateral directions, and it does circumduction as well. Now, do you know these movements? The answer is yes. There is a special YouTube film that demonstrates all these movements. Now we come to a very important issue in any joint, and that is stability. You may remember that the shoulder joint was not very stable, and you know the reasons. Now, what about the hip joint? The hip joint is very stable. And what are the main factors that make the hip joint stable? Is like shape of the bones, the weight of the body. The hip joint transmits the weight of the body from the vertebral column to the pelvic girdle to the femur, and it has strong ligaments, and there are many muscles around the hip joint. Now, the bones making the hip joint. It is the head of femur covered with articular cartilage, and then the head of the femur is going to sit in the acetabulum. What is the acetabulum and what are its main features? It is cup-shaped depression, and it is made of the three bones of the hip. Then it is having an addition to its depth by having the acetabular labrum, just like the glenoid cavity. And this acetabular labrum is made of fibrocartilage, and you can find it at the margins of the acetabulum. Then the acetabulum has articular hyaline cartilage in shape of a lunar structure, and therefore the articulating surface of the acetabulum is made of two parts. The part that articulates with the head of the femur is called the articular surface, and the center of the acetabulum is not articulating with the head of the femur. And then at the inferior side of the acetabulum there is a notch, and this notch is covered by a ligament called transverse acetabular ligament. In this mind map, we had an idea about the bones making the hip joint. Now, the hip joint as a synovial joint, it has a capsule, and it is called the articular capsule. This capsule is very dense and very strong, probably because this joint is weight bearing. Now, what is this articular capsule made of? It is made of longitudinal fibers running obliquely from the hip to the femur, and circular fibers, which is called zona orbicularis. It is around the neck of the femur. So the conclusion is that this capsule is very well arranged and very well designed, and it is strongest anteriorly, and it extends from the rim of the acetabulum on the hip bone down to the neck of the femur. Now we come to the very important subject in any synovial joint, and that is stability. Now, one of the factors that is going to add stability to the hip joint is ligaments, and we have three important ligaments and a fourth which is less important, and we will come and discuss why it is not very important. The first ligament is iliofemoral ligament, and from its name it extends from the ilium to the upper end of the femur. And let's collect some data about this. It is thick part of the capsule. It is not a separate ligament. It is a thickening of the capsule, and it comes from anterior and inferior iliac spine to the intertrochanteric line running between the greater and lesser trochanter of the femur, and it is Y-shaped. Now, this Y-shaped structure is going to make our lives easier, because we can see that it is an inverted Y-shaped, meaning that the one limb is superior and the two limbs are inferior. Now, what does it do? It is a very strong, it is the strongest ligament, and it prevents hyperextension of the hip. That means it prevents the person from moving the leg posteriorly more than enough. And it comes from where? It comes from the anterior inferior iliac spine and attaches to the acetabular limb, and it goes to the intertrochanteric line. Then we have pubofemoral ligament. From the name, we can conclude that it comes from the pubis going to the head, to the upper end of the femur. It is a thickening part of the capsule, just like the iliofemoral, and it is not a separate ligament on the outside. And where do we find it? We find it anteriorly and inferiorly, and extends from the rim of the acetabulum to the neck of the femur, just like the iliofemoral, and it prevents over abduction of the hip. Then the third one is the ischiofemoral, from the ischium to the upper end of the femur. It is a thick part of the capsule, just like the other two, and it reinforces the capsule posteriorly, and from the ischial part of the acetabulum to the neck of the femur, and it is relaxed in adduction and tensed in abduction. Now, the ligament of the head of the femur, it is flat triangular, extending from the fovea capitis. You may remember the fovea capitis is a depression in the head of the femur and extends from this fovea capitis into the acetabular fossa, and it is mainly for bringing blood supply to the head of the femur. It is not a stabilizing ligament. After having an initial idea from the mind maps of the hip joint, now we are going to demonstrate the things we have read about. This is the hip joint. Where is the hip joint? It is between the upper end of the femur and the hip bone. The hip bone is making with the other hip bone the pelvic girdle, and the pelvic girdle connects the lower limb to the axial skeleton. And there is an important point here, and that is there is transmission of weight. Probably this is an opportunity to revise our knowledge of synovial joints, and it is made of the following order. It is a bone covered with hyaline cartilage, and there is a cavity, and then the hyaline cartilage of the next bone. Now, this cavity is on the outer side fibrous tissue of the capsule, and on the inside it is the synovial membrane, which is going to secrete the synovial fluid, and there is a fatty pad between the synovial membrane and the surrounding structures. This cavity is very important in synovial joints because it is this structure with the synovial fluid that makes the wide range of movement property. Here is a view of the acetabulum, and the theme of this image is that the three hip components contribute to the formation of the acetabulum. Here is the contribution of the ilium, and here is the contribution from the ischium posteriorly, and the pubis as an anterior bone also contributes to the acetabulum. This is a real hip bone, and we can see the acetabulum, and what is visible is the depth of the acetabulum, and we can see that it has a rim on the outer circumference of the acetabulum, and there is a depression anteriorly and inferiorly. This is called the acetabular notch, which is going to be closed by a ligament. Now, this is looking at the acetabulum in face. That means we are looking at it from the front, and we can see that at the periphery, or just on the inside of the rim, there is a lunar or C-shaped area which is covered by hyaline cartilage. This is the articular part of the acetabulum, and the center is not covered by articular cartilage, and this is called the non-articular surface of the acetabulum, or it is called the acetabular fossa. This is another look on a drawing of the acetabulum, and we can easily demonstrate the C-shape or the lunar articular surface and the non-articular surface, plus transverse acetabular ligament closing the notch inferiorly. In this image, I can see that there are two arrows to the left. This arrow is indicating a ligament coming from the fovea capitis of the head of the femur, and the ligament extends into the acetabulum, and this is called ligamentum teres. Now, in this three-dimensional image, we will have two arrows indicating two parts of the acetabulum, and I will leave the decision what are these two arrows pointing at to you to test your knowledge. What is this structure? You can answer that very easily. That is the head of the femur. How do I describe it? It is hemispherical. It is more than half of a ball, in contrast to the head of the humerus, which is less than half of a ball. And you know what structure is this? This is easy, and this is as well, and this is the non-articular part of the acetabulum, and in this image we can see the ligamentum teres extending from the fovea capitis to the acetabulum. There is a blue tissue connecting the acetabular margin to the neck of the femur, and we can see two things. The part attached to the acetabulum has longitudinal fibers, and the part as if it is a belt around the neck of the femur, and this is called the orbicularis part. Here is an image which demonstrates a very important fact, and that is, here is the beginning of the capsule attached to the rim of the acetabulum, and as it goes towards the upper end of the femur, it is going to attached not at the end of articular cartilage, but at the beginning of intertrochanteric line anteriorly and intertrochanteric crest posteriorly, and it is happening on the superior and inferior sides as well as all around. What does that mean? It means that the head is inside the capsule, and not only the head, it is the neck as well. Is this situation the same as that of the shoulder joint? The answer is no. In the shoulder joint, the capsule is attached to the margin of the articular cartilage. Here is remembering what is the capsule of synovial joint is made. It is made of outer fibrous connective tissue and an inner synovial membrane that is going to secrete the synovial fluid, and the synovial membrane lines the capsule, but it stops at the margin of the articular cartilage. Looking from the left, we can see that this is the capsule extending from the margin of the acetabulum to the intertrochanteric line. That is an anterior view. Then we know now that the important ligaments of the hip joint are thickening of the capsule. They are not separate ligaments. And here we have a ligament extending from the ilium, and it is an inverted Y-shaped structure. Therefore, this is the iliofemoral ligament. The name indicates that it extends from the ilium to the femur. Then, looking also anteriorly, we can see that this triangular structure is the pubofemoral ligament between the pubis and the femur. And as we go and have a look posteriorly, we can see a ligament extending from the ischium to the femur, and therefore it is called ischiofemoral ligament. Now you are well instructed to recognize this ligament, which is the, as you can read it, and this is the, as you can read it. Here we have anteriorly the Y-shaped, the inverted Y-shaped ligament, which is the iliofemoral, and deeper to it is the pubofemoral ligament, and on the posterior aspect we have the ischiofemoral ligament. This is a nice image of the inverted Y iliofemoral ligament. Let's review. Ligaments of the hip joint: iliofemoral, which is inverted Y-shaped structure; the pubofemoral, which is triangular; and the ischiofemoral, which is spiral. These are the movements that can be done by the hip joint. It is flexion, extension, abduction, adduction, rotation, lateral and medial, and circumduction. Now, you know these movements, and there's a special YouTube film about what are these movements. Study this demonstration of what the hip joint can do. Whenever we talk about synovial joint, we must address stability of the joint. Now, the hip joint is quite stable, and this is a very important notice. If it is quite stable, it is hard to dislocate, hard to pull the head of the femur out of the socket. Why is that? Because of the bone shape. What does that mean? That means that the head is more than half of a sphere, and the acetabulum is deep enough for the head to go in, and there are the strong ligaments, the thickening of the capsule all around. It is not like the shoulder, where the thickened ligaments of the capsule are only anteriorly. They are lacking posteriorly and inferiorly. And then we have muscles, especially the medial and lateral rotators. These muscles, they pull the head of the femur to stay in the acetabulum. In the shoulder joint, we had the group of muscles which are called the rotator cuff muscles, and the acetabular labrum, which adds depth to the acetabulum, in addition to its already deep structure.